Hello friends, I am Dr. Premanand Das. Now I am discussing with you how to diagnose low pathogenic avian influenza or H9N2 infection in lyrebirds. First of all, we see the cyanosis of the comb and wattle of the bird. Then we identify the hemorrhagic lower eyelid of the bird. I turn out the lower eyelid and find out the hemorrhage in lower eyelid of the bird. I cut the lower eyelid. Here you see hemorrhagic lower eyelid of the bird. Then I cut the neck region and find out trachea. Here we find out caseous exudate in the tracheal region. Here you see that white caseous exudative mass in the tracheal region. Then we diagnose the tracheal ring of the bird. Here hemorrhagic trachea we identified. Hemorrhagic shank and feet of the bird. Then I cut the abdominal and thoracic cavity of the bird. Under the skin layer, here you see internal muscular hemorrhage. Necrotic liver we identified. Then we identify the pinpoint abdominal muscle hemorrhage. Then we identify the bleeding in the thorax or thoracic cavity under the keel bone of the bird. Here we see some bleeding, pathognomonic lesion for avian influenza. Hemorrhagic heart. The heart becomes hemorrhagic in LPI. Then we identify the ophuritis of the bird. In the abdominal cavity, the egg follicles become ruptured. We call it ophuritis. It's a lesion for LPI. Then I turn out the proventriculus of the bird and find out pinpoint hemorrhage over the proventriculus wall. Pinpoint hemorrhage. I cut the proventriculus. Here is no hemorrhage you see. In primary infection of the LPI, here is no hemorrhage, but in secondary infection, the proventriculus become hemorrhagic and turn into the high pathogenic avian influenza. No hemorrhage you see. Internal muscular hemorrhage in the thigh muscle. That's all our presentation. If you like the video, please subscribe my channel. Thank you.